vaccine rollout has been a major success.
More than 20 million people in the UK have now had their first coronavirus jab.
We have now vaccinated over 25 million people.
More than half of adults in the UK have now had a first dose of the Covid vaccine. More people received the jab.
It's all going so well. So well, we're looking ahead to what might be, what we've been told should be. Discussions of pubs and reunions, holidays and nightclubs. But that's not what they're talking about in the corridors of Whitehall. Instead, there is a subject about which there is anxiety, consternation, even some fear. I understand that advice is currently being drawn up for the Prime Minister by officials on stage 1 of the roadmap and whether we are ready to exit the first round of restrictions. Now, in many ways, this is a foregone conclusion. On the 3 tests that Boris Johnson has set out, vaccinations, infections and hospitalisation, the UK is performing extremely well. But it is on test 4, on the emergence of new variants and the possibility they may alter the balance of risk, that I'm told there is most concern, and officials are warning the Prime Minister that it is those variants that could, at least in the future, have the strongest possibility of derailing the roadmap that he's set out. The foreign variants of COVID are currently at low levels in the UK, though they are increasing. But it is B1351, the South African variant, which is causing most concern, currently at 412 probable cases in the UK. Officials are worried because internal estimates suggest it might reduce some vaccine efficacy to less than 50%. Therefore, if it were to become widespread in the UK, it would significantly reduce the vaccine rollout's effectiveness. Therefore, I'm told that officials from the Variation and Mutant Task Force within Public Health England have written to Matt Hancock today to inform him that they've traced variants being imported to UK from the following countries over the last 42 days, including Ireland, France, Germany and the United States. None are currently on the red list, which subjects arrivals to mandatory hotel quarantine. It will be up to him and the Prime Minister to decide whether the risk of variants is sufficiently grave to change that.
We have measures going in the other direction.
And that has to...
Testing arrangements in
The
place.
chair of the Home Affairs Select Committee, who pressed the Prime Minister on this issue of variants coming into the country in Parliament just yesterday, says that this is a symptom of a border which is still too porous.
We have a natural advantage in our geography in terms of having COVID border measures in place, but too often there's been delays in actually using that and not having, for example, the proper testing systems in place or the proper comprehensive quarantine system in place. So, for example, we know that people can still go onto public transport home in order to quarantine at home, whereas South Korea makes sure that you can't do that if you're supposed to be quarantined and you have to have safe arrangements to get home.
I've also seen a document which instructs Public Health England's regional teams to begin to prioritise the contact tracing of the South African variant above all of the others. Now, as we've said, overall numbers do remain low, but there is concern that A, they calculate around 24% of the South African variant cases in the UK are not connected to international travel, which might indicate a rising prevalence in the overall population, and that B, the growth of this variant at the moment is being inhibited by lockdown, and when that goes, that check on its expansion will be as well. And right now, what makes scientists worried about variants is still how little we know.
We have tests that can examine one part of how the immune system responds to a vaccine and therefore to a virus variant, but it doesn't tell us the whole picture. And so that's why we have to be cautious at this stage, is that the South African variant is apparently better at evading at least one part of how our immune system responds, but we don't know the whole picture yet, and that's why we need to tread carefully.
This is one of those times where the conversation we're having in public is different to that of Whitehall in private. We are looking ahead, they worried about what might unfold much sooner and what might yet derail the best laid of plans.
Lewis Goodall there. Well, a spokesman for the government told us the UK has some of the toughest border measures in the world and that the red list was being kept under constant review. Public Health England told Newsnight that recent studies showed vaccines are effective against the dominant variants in the UK. A spokesman added that officials were monitoring all variants closely and would take necessary actions when they see variants of concern in the UK. I'm joined now by political editor Nick Watt, who's got news on variants and vaccines from Brussels. Nick.
Yes, well, Kirsty, we heard from Lewis there about concerns in Whitehall about variants, and in particular the South African one. And in the last hour or so, concerns voiced in Brussels about the B117 variant, otherwise known as the Kent variant, which was obviously behind the wave that we hope that we are now beginning to come out of in the UK. Now, Ursula von der Leyen, who's the European Commission president, she said that that variant is mostly to blame for the rise in infections across the European Union at the moment. And then she then said, well, that shows the importance of getting on with the vaccination programme. Then she talked about her plan that she outlined yesterday that could lead to a ban restrictions on exports of vaccines coming out of the EU. There were two ideas at the heart of that. The first one is reciprocity. Are countries that are receiving EU vaccines, are they putting restrictions on things that they're sending elsewhere? And proportionality. As a country receiving EU vaccines, are they doing better on their vaccination programme? Ursula von der Leyen very much gave the impression that that idea was alive and kicking. But when you actually look here at the Council conclusions, that virtual meeting of all the EU leaders, much milder language. It talks about we underline the importance of transparency as well as the use of export authorisation. So that's in her territory. But then it says we recognise the importance of global value chains. It looks like there were decisive interventions to water it down by Angela Merkel, the German Chancellor, and Mark Rutte, the Dutch Prime Minister.
So dissent in Brussels, but back here in Westminster there was also dissent and there was a Tory rebellion.
Yes, so a rebellion when 35 Conservative MPs plus a teller voted against the extension until October of the Coronavirus Act, which underpins many of the measures during the pandemic. There was no rebellion because there was no vote on the public health measures which underpin the current lockdown. And the reason for that is the rebels are happy about that one because they will expire at the end of June when hopefully we reach the end of the roadmap. But grandees, Graham Brady, Charles Walker, not happy that the Coronavirus Act will keep going till October, not happy that Matt Hancock, the Health Secretary, was unable to say whether he might seek another extension of that act in October. The government says, look, this is not really about restricting the liberties that you're so upset about. It's things like allowing courts to meet remotely. They say, no, it gives powers to police officers to visit homes of infected people. But interestingly, a year into this pandemic, we're in a big lockdown. Boris Johnson is still holding his party together because if all the opposition parties had voted against this today, which they didn't, he would have still got it through.